You've decided that your patient has a ruptured abdominal aortic aneurysm. Now what? In any exam that you do, from final med all the way through to final FRCS, if you're asked how to manage a ruptured aneurysm, you need to answer as if you're reading from a checklist. This mental checklist will also stop you panicking when you have to manage a ruptured AAA for real. I find it helpful to divide management of a ruptured aneurysm into do's and don'ts. Do give them oxygen 15 litres a minute via a non-rebreather mask, establish intravenous access with 2 large bore IV cannulae, send blood for a full blood count, urea and electrolytes, clotting and a cross-match, get an ECG, call the vascular surgeons and anaesthetists. If the patient has not just had a CT scan to make the diagnosis, call radiology and make sure they have some pain relief on board. What about the don'ts? Well, don't push fluids to normalise the patient's blood pressure. If they're talking to you and they're orientated, then they're perfusing their brain, so their blood pressure is adequate. Chasing a normal blood pressure reading is just likely to make them bleed faster. Don't delay a trip to CT or the operating theatre in order to place urinary catheters, arterial lines or central lines. And don't delay a CT scan waiting for renal function results. The CT determines if the AAA is stentable, and if it is, the vascular team will give them contrast regardless of their renal function. We can fix a ruptured aneurysm either using an endovascular repair or an open approach. We tend to prefer an endovascular repair if at all possible. The mortality between endovascular repair of a rupture and open repair of a rupture is the same, but patients treated with an endovascular repair tend to have a shorter length of stay and better quality of life out to 3 years, at which point it is cost-effective in trials of the two techniques for ruptures. What's the prognosis with a ruptured aneurysm? Traditionally, we talk about the rule of 50s for this. So 50% of patients with a ruptured abdominal aortic aneurysm will make it to hospital alive. Of these, 50% will make it out the other side with a repaired aneurysm, although in many units these days, the outcomes are somewhat better. The revision notes are available free at www.vasculartutor.com. And don't forget before you go to throw us a like and subscribe for more videos.